Welcome, everyone. This is the third conversation in our Mobilize series for 2023, and it's called Step by Step, Supporting Active Transportation. So we're going to start off by introducing our exciting presenter and move into their presentation and then get into a discussion with our fellow panelists, followed, of course, by audience Q&A. So if you have any questions, thoughts, or comments throughout the presentation, please feel free to drop them in the chat. We're going to try our best to get towards them in the end. So for the Mobilize series, we are exploring the ways and the means in which we get around our cities and our communities. So in Jamaica, but I assume it's probably very similar for many other cities across the Caribbean, a supermajority of our residents do not own cars nor use them as their primary mode of transportation. Despite this, the infrastructure that makes up our transportation network is specifically designed to advantage private car use over all other alternatives. So with a transportation system that we describe as being distinctly car dependent and it lacks alternatives, getting around Caribbean cities is a major source of frustration for us all. So whether you drive, you take the bus, or you walk, moving through our cities is really any combination of expensive, unpredictable, time-consuming, and increasingly more dangerous. So with the Mobilize webinar series, we really aim to explore how peer cities are transforming their transportation systems to be more efficient, to be more safe, and to be more equitable for all. So my name is Doreen Duncan. I'm one of the founders of Island City Lab, and we are a Kingston-based urban think tank really dedicated to understanding the unique features and challenges of small island cities in the Caribbean. So our aim is really to improve our built environment by building, fostering, and convening a network of civic thinkers, aka you all, to really confront these challenges. And this forum is a part of that programming. So our keynote today, who I'm super excited to introduce, is Cyprine Odada, who is an urban planner with a keen focus on non-motorized transportation. She's also one of the lead organizers and coordinator for Critical Mass Nairobi, which currently stands as the largest gathering of non-competitive cyclists in Africa, who ride together every last Saturday of the month with two objectives. One, getting as many people back on bicycles, and two, revolutionizing Nairobi's transportation system to enhance safety for non-motorized road users as well. As a mother and as an avid cyclist, Cyprine seeks to get more people back on bicycles and change how people view, experience, and interact with bicycles. So by the time that her little one is old enough, she can safely enjoy the joy of riding bicycles without fear or without intimidation. So with that introduction, I'd like to hand it over to Cyprine.
Thank you, Doreen, and thank you so much for having me on this Mobilize series. As you've shared, my name is Cyprine Odada, and I am a mother to two young, feisty little girls who I hope will not be banging on my door right now. I'm an urban planner in Kenya, and I stumbled upon cycling by mistake. I stumbled upon cycling because I was stuck in traffic once upon a time, and I got tired of being in traffic, and I wanted to find an easier way of moving, of commuting, and that's how I ended up using my husband's old bicycle. And from then on, I think it's just been a wonderful journey of rediscovering who I am as an urban planner, discovering who I am as a citizen, and what my role is in fighting for vulnerable road users. So thank you so much for having me.
Thanks, Cyprine. You can go ahead and share your screen.
Okay. Okay, so Doreen asked me 4 very simple yet complicated questions about my cycling experience in Nairobi. And they're simple because they should be easy to answer, but I come from a background of being an activist, so I always feel like there's a lot that I want to share, but there's also very little I can share in such a short time. But I'll do my best to try and give a an overview of what it is to be a cyclist or a road user in Nairobi. So I'll start with the current population of Nairobi. I'm going to be very quick on this. Right now Nairobi is at 4.7 million people. Last year we had around 3 million people, and it's expected that we will have a booming 7-point-something million people by 2030. And the current model share in Nairobi is majority of road users are pedestrians. In fact, majority of road users last year were pedestrians at around 47%. That number has changed now. Pedestrians are now at 40%, similar to public transport users. And we have private car users at 14%, and motorcyclists. We have an upcoming popular mode of transport called boda boda, which are motorcycles that are used as public transport. We call them boda boda. And then we have my community, cyclists, at 1%. I want to say something about this transition from 47% of people walking to now 40%. And I think that's a testament to our roads, our walking infrastructure that are making people not want to continue, that are making less people to want to continue walking, and more people now to transition into public transport. I don't know if anyone has had a view of Nairobi or has visited Nairobi, but you will quickly see that there's a disproportionate allocation of road space on our roads. You'll find these people, the 14%, occupy majority of the road space, and that is including parking facility. And in my training, I learned that a road is considered a public space. So when we have 14% of the road users occupying majority of the road space, there's clearly some road users who will not be able to enjoy that road space. And those road users, in most cases, are pedestrians. And in Kenya, the public transport system is mostly supported by pedestrians and to some extent cyclists. So with this number taking majority of the road space, there's a lot of chaos and confusion that we experience on our roads. So the results of our road system is we are known for our traffic jams. We always advise people to leave their homes an hour before. We have our air quality has really declined over the years. Traffic crashes have increased. We have quite a number of fatalities, injuries, and losses, both loss of time, loss of productivity, financial losses from the road crashes. And because of the traffic jams, the economy is also declining. I think I don't remember the exact figure, but right now, if you compare to the dollar, we are at, I don't even want to say, it's really sad. And then there's also the loss of valuable social time that we could be spending with our families or our friends, or even, with ourselves doing things that we enjoy. A lot of that time is wasted in traffic. And there's also the general decline of health and well-being of the population. I think obesity has surged in the city, and cases of non-communicable diseases have also gone up. And all that can be attributed to our road system, our road designs. So to be more specific with cycling, I was asked to share what the challenges we experience in Nairobi. And with cycling, one of the reasons why we are at 1% is because very few people are willing to cycle. Our cycling infrastructure is dismal compared to what has been provided to private car users. There's also the cultural perception that people have towards cycling. Unfortunately, in most African cities, cycling is considered a poor man's mode of transport, or an elitist sport. So a lot of people shy away from owning bicycles or riding bicycles because they will be given this negative, because of this negative connotation. And then we have our weak policies that do not necessarily protect cyclists or advocate for cycling. I think in Kenya right now, if you were if a cyclist was involved in an accident, it would be very difficult for the cyclist to claim compensation or any kind of our laws are very weak when it comes to cycling. And then our design, the way our roads are designed, they don't favor cyclists. And even the roads that have cycling lanes, you find the design is the roads that the cycling lanes are not necessarily designed to ensure the efficient movement of the cycling from one point to the other. You find this discontinuity or physical barriers on the cycling lanes that would ensure the cyclist cannot use that bike lane and have at one point end up in the main carriageway. And then we have our education system, which mostly supports a more car-centric designs. I'm an urban planner myself, and I remember when I was in school, the plans we were coming up with were looking at how to design the city for cars first, the movement of cars, and then pedestrians. And I don't recall cyclists being mentioned in anything that I studied at school. And even when I look at the engineering curriculum for civil engineers, there's very little mention of non-motorized transport. So our education system also plays a significant role in how bad our transport system currently is. So what are we trying to do? How are we trying to transform our city to being a city that is more livable, a city that is more accessible? And now I'm going to share a brief history of Critical Mass. Critical Mass began in 2014, and initially it started as just friends coming together to cycle and spend time together. And then with time, this movement started getting a voice that would help the cyclists address some of the barriers that they are experiencing. So I joined Critical Mass in 2015. And at that time, when I was joining Critical Mass, I had just moved to Nairobi. I didn't know anyone. I mean, I knew very few people, but I didn't have a lot of friends. And I was lonely and I wanted to exercise as well. So picked up an old bicycle that we had and went on this escapade on the streets of Nairobi. Met two gentlemen who introduced me to the group. So when I met the group, I always try and find a way of describing the feeling, but I can't really, describe how happy I felt when I met. I think that time there were around 10 or so cyclists. I felt like I met my family. And with time, unfortunately, because the roads were our roads back then were very dangerous, and the experiences that we were having from other road users was not very encouraging. So the movement started dying, but I had already found a family that I wanted to hold on to. And I remember when I started cycling with this group, I had actually abandoned urban planning. I wasn't proud of who I was. I didn't want anyone to call me an urban planner because I was experiencing the disservice that we were doing to road users, what my training as an urban planner was doing to road users. So for a very long time, I did not want to associate myself with urban planning. But as I continued cycling, I realized there's an opportunity for me to share my experiences and use my lens as an urban planner to communicate the experiences that cyclists are having. So in 2016, I took over the management of Critical Mass, and I was very intentional about growing this movement because for me personally, it really helped me come out of that terrible mental state that I was in, but it also helped me gain my physical fitness. But it also created an opportunity for me to tell a story, the story of cyclists that was not being told. And I was very intentional about growing the number of cyclists that are in Nairobi. I wanted to challenge that 1% that unfortunately was being used by our road agencies to determine how the roads were being designed, how much space was being allocated. So backed by this desire to change the status quo, I put together a team, and we decided from then on, from 2016, that every last Saturday of every month we will have a ride, no matter what. I wanted to add another photo of myself being 8 months pregnant on a bicycle, but I was very intentional about showing up no matter what. And that was very inspirational to a lot of people, because now people could see people who wanted to cycle could see cyclists on the road, or people who had bicycles in their homes or under their stairs, or bicycles that they've not touched in years could see cyclists are now, coming out of their homes or regaining their confidence. And yeah, so the movement just started growing. And in 2014, I think we were, less than 20, and then 2015 the number started skyrocketing to now having close to 400 cyclists every month. I think from the COVID, between 2020 and 2021, our numbers started tripling. Yeah, and now we can't even fit in one group photo. We gave up trying to put everyone in a photo, but we try as much as possible to capture as many people as possible. So after attaining our first objective, our initial objective of getting people back on bicycles, we realized that now we need to do something else. We already have attained that people want to cycle. We've demonstrated that people want to cycle. So we sat down and thought about what else can we do now that we have a voice. And making some recommendations to the policies that we have was something that was of importance to us. So we were very keen on advocating for better laws for cyclists. And in 2015, there was a non-motorized transport policy that was adopted by the city of Nairobi, which dictated that all new roads in Nairobi will have, at the very least, walking infrastructure. And I'm happy to report that Nairobi now, unfortunately, I don't have the figures, but Nairobi now has several kilometers of walking infrastructure and some cycling infrastructure. We still need to do a lot more advocacy to get cycling, but at least there's space now for a lot of people to walk. And then the design of our roads, we also now very intentional about advocating for better roads, not just putting any type of road. We want roads that are well connected, that are usable to to people with all types of mobility, whether someone is on a wheelchair or someone is an able-bodied person. So we are really advocating for better laws, and also doing a lot of advocacy on road safety. I'm gonna go to the next slide. So the other thing that we realized was, most of the time when conversations on investing in cycling were being held, we were told that cycling does not attract financing compared to other modes of transport. So what we decided was, we are going to try and position ourselves in a way that we can attract funding. This is something that we've just started doing this year, and I think I'll share a bit of what we have done. We have been documenting a lot of the things that we're doing. We are taking photos and we're telling our policymakers what we are doing, and also showing them the numbers, so that in case we are not able to do a comprehensive study to count how many cyclists are there in Nairobi, we are hoping that the photos themselves can pass a message to the policymakers. The other thing that we are also doing is we are collecting our own data. Recently, we mapped all cycling lanes in Nairobi, and that we gave that data to the county government of Nairobi. The reason we did that was we wanted to clearly demonstrate to the county government that yes, they are putting in some infrastructure, but the infrastructure is not really safe or usable. So we mapped all the cycling infrastructure in Nairobi, identified and had and geolocated each and every barrier, and gave the county the status of each and every cycling lane in Nairobi. So we are trying to position cycling to be bankable. There's a new phrase now called bankability. So we wanted to reduce the excuses that policymakers have when it comes to investing in cycling. So by collecting our own data and mapping everything, we wanted to make it easy for even investors to identify, to see that these people are really intentional about changing how they are perceived and changing their numbers and changing the data that is being used to design their roads. So what can I share with everybody else who is trying to start their own critical mass? Now, the first thing is to have a clear vision of what you want for your city. And this vision has to be, it should not be attached to anything political, because political things tend to fall or to end when a new government comes into place. So having a clear vision that is not tied to anything that is external is very important. And then the second thing is to be consistent. We decided a long time ago that every last Saturday of the month, all road users in Nairobi will see cyclists in Nairobi. We want road users to know that cyclists exist and to learn how to interact with cyclists on the road. So that consistency has also given confidence to cyclists who are scared, because now they know if they come to our starting point at that specific day, they will find other people and they will cycle together. And then we ensure that our rides are accessible to anyone. I remember when we first had the conversation with Doreen, there was a question of whether the rides are specific to people who have specific types of bicycles or who are from a specific class. And I said, no, our rides are for everyone. We have the brokest person in town, and we have CEOs who come for the ride. And what that does is it breaks that communication barrier between classes, but also just brings people together. Sorry, I can't see my next. Yes, and then we ensure that the speeds that we have during the rides are speeds that anyone can maintain or can manage, and we do that by having children. We have children as young as 5 years old, and the average distance we cover is around 28 kilometers. And the kids do it, and they do it so well, and they come back and they're so happy. And if the adults who are not used to cycling get, encouraged when they see kids like that, young kids cycling, and the kids are always the pace setters. We move as fast as the slowest child. The other thing that I will advise to anybody, especially in Africa, is it's important to build a good relationship with the city official, because at the end of the day, if we are not working together, it is very easy for them to stop our activities. So it is important for us, for anyone organizing critical mass, to have a working relationship with the city officials, because in a way we are doing the city a favor by trying to transform it to be safer, more accessible, a cycling city. So we are doing them a favor, but they're also doing they are also doing us a favor by creating a conducive environment for us to cycle. And also the traffic police. We've been very favored by our traffic police, and they support what we do. They always give us priority on the road. And I think that has a lot of it has to do with the fact that we have children and women in our rides. Maintaining order is important. Like any other group, having a big mass, it's very easy to get carried away and having a mob mentality. So it's important to also maintain some sort of order and having a team of people who can help beginners or just help other people who are riding. And then make it fun, make it enjoyable so that people would want to come back. I think that was my last slide. But all in all, our critical mass rides are meant to make anyone want to cycle. And I think we've done a great job, and we've been able to inspire other cities in Kenya and other cities in Africa. And I'm truly honored that, I'm speaking to people in Jamaica who are looking at what we've done and wishing to learn, who wish to learn what we've done. And I just, if we could have a Critical Mass Kingston happening sometimes, I'd be very happy to attend.
Yeah, I mean, thank you so much for that, Cyprine. I think so much of what you said and so much of your story resonates with me also as a trained urban planner, right? And I think a big part of why we wanted to have you on this webinar is the uptick, right? I was told here in Jamaica by other Jamaican planners that Black Jamaican people don't cycle, right? And I was like, yes, we do. We see them all the time. But I think to your point about the kind of the class issues, it's either really rich people who have the money to afford a $2,000 bicycle, or someone who has no alternative, right? And that doesn't really create a lot of space for the possibility of cycling being a legitimate part of our transportation issue, right? So thank you so much. And I want Jordan to bring on our other panelist. I believe my video just paused. 1 second. So I'm just going to go ahead and hopefully my video decides to work again. So first we have Charles Val Carnegie. He's an anthropologist, professor emeritus at Bates College, and the author of the book Post-Nationalism, Prefigured Target Borderlands. Val has become increasingly concerned in recent years about the damaging effects of Kingston's changing physical and social fabric. The ways in which these changes impede the building of a more unified, happier, healthier, and more beautiful urban community. So he's been involved with advocacy groups like the Citizens' Right to the City, and has published various articles about Kingston's sort of misaligned priorities, including, most aptly, Walkfoot People Matter, and the loss of the veranda Kingston's constricted post-colonial geographies. We also have Kimisha Dixon. She's an accident analyst and statistician at the Road Safety Unit. She's trained in road safety audits and inspection. She also possesses training in traffic crash investigation and reconstruction and analyzing event data recorders. So for those of you who don't know, the Road Safety Unit is under the Ministry of Transport of Jamaica and promotes an orderly and disciplined traffic culture that is conducive to safe traffic environment for all road users through public education, legislation, data collection, and research. I'm going to pin you all. So I'm going to hand over to you first, Val. Could you, I think lots of what Cyprine was talking about was kind of the cultural perceptions around cycling. Could you kind of speak to the cultural context that exists here in Jamaica that sort of leaves the broader society not to deem, quote unquote, Walkfoot people as worthy of protection and comfort on our roads?
Thank you, Doreen, and thanks to Cyprine for that really inspiring presentation about what she's been doing in what's been happening in Nairobi. Yeah, I think in Jamaica, it's important to remember that the car thing is pretty recent, and that up until 50 years ago, it was much more common to see people owned cycles and commuted by bicycle much more regularly, much more frequently. I think the other thing though is that I'd want to say is that Jamaica is and the Caribbean is supremely status conscious, and in the days of plantation slavery, for example, there were laws about the enslaved people traveling by horse, that you couldn't travel by horse because horse travel came with a certain status, right? So if you're traveling by horse, you had to be carrying a permit, doing it on behalf of your owner. Now, I'm not saying that there's a direct line of continuity between that and now, because as I also am saying, there was a long period of time, even after automobiles came in, first when they weren't quite affordable, but also people of all classes rode the tram cars in Kingston and cycled in Kingston and walked in Kingston. But car ownership and car mobility have become one of the marks of status distinction. So we can't get this status pecking order out of our minds, out of our habits, and we find ways of differentiating ourselves through these various things, such as modes of transportation, is one of the things I would say in response to that question.
Yeah, that kind of historical context. We understand.
Not hearing you.
Oh, are you hearing me now?
Yeah.
Okay, sorry about that. So I kind of wanted to go over to Kenesha. So we understand you kind of contextualize why people who walk with people, so we call it in Jamaica, or cyclists are kind of deemed less than because of the kind of historical classism that exists in lots of Caribbean cities, right? But I want to ask Kenesha about what that means on the ground. What does that mean for pedestrians and cyclists today in terms of their level of safety, their level of vulnerability on our roads? Over to you, Kenesha. Yeah, man, we're hearing you.
All right. Yes. Good afternoon, everyone. So, as it relates to pedestrian, for non-motorized road users or cyclists and pedestrian in terms of statistical data. Yes. So, for pedestrians are among the top 3 categories of fatalities recorded over the years. Examining pedestrians' annual data for 2022 and 2021, it has reflected a 24% increase. That is like a difference of 5 fatalities when compared with the prior year. So over the 5-year period, pedestrian accounted for 33% of the overall fatalities. That's like 128 fatalities in total. So since the start of the year, pedestrian, and this data is just only for Kingston and St. Andrew.
Wow. And I'm curious, Kenesha. So road safety
For
unit.
pedals.
Oh, go ahead.
Just for pedals, right? Yes, go ahead. Yes.
No, go ahead with the steps for pedal cyclists as well.
Okay, so I was just skipping on to pedal. Okay, so for pedal cyclists, it's not so much of fatalities, but they account for like 7% of the overall fatalities over the 5 years period, and that's like 7%. That's 7% of the overall fatalities, which is 28 deaths. Examining the 2022 and 2021 fatalities data for pedal cyclists, fatalities reflect a 29% decrease. So yes, it's trending down when we compare the prior year, compared it with the prior year. But since the start of the year, for Kingston and St. Andrew, pedal cycle fatalities is like at 4 fatalities so far.
Yeah, yeah. One of the things I wanted to bring up was that I don't know if it's different in Nairobi, Cyprine, but like on Jamaica news, when a massive car accident happens, it ends up on TV. When a pedestrian is hit and it ends up in a fatality, that doesn't appear on the TV at all. It doesn't appear on news at all. So I think there's also a sort of a lack of empathy and like recognition of personhood that happens, right? That if a pedestrian gets hit, they just got hit. You know what I mean? It's not even going to come up on radio. And I'm curious about if there's a different sort of perception held in Nairobi in the media as well about people who can afford to drive a car and get in a car accident versus people who have no other choice but to walk or to take a cycle.
Yeah, no, it's very similar. There is a general underreporting of pedestrian fatality, the injuries and the near misses. You know, sometimes you don't have to die for it to be a dangerous experience or a bad experience, but the near misses are so underreported. And I think there's need for road agencies and the road safety agencies as well as the hospitals to start working together, because somebody can have, let's say, could be hit but not severely injured, but then 10 days down the line, they realize they have internal bleeding and then they die from it, but reported as the traffic crash as being the cause of that accident. So there's need for different sectors to start working together and identify and documenting the actual causes of the death and communicating with each other and identifying black spots, because to me it doesn't make sense why let's say one road would report deaths on one specific intersection and something not being done. And if pedestrians are dying at a specific spot, then some intervention has to be done, and we can't just keep reporting how many car users have died. And
Yeah.
Maybe just to add to that the question and thinking of it from the Jamaica point of view. I mean, I'm struck always by the earnestness with which some of the main radio stations they have traffic reports in the mornings and in the evenings, you know, and great earnestness. I mean, they pay attention to not only congestion, but they pay attention to obstacles on roadways that create congestion, things that need to be repaired, and so on. By contrast, if you're a pedestrian or a cyclist, the obstructions and so on don't get reported. The manhole covers that people could fall into, the obstructing utility poles and construction debris that impede the use of sidewalks that are already in poor shape, poorly constructed, and so on, that deteriorate people's shoes. So people are much more concerned with, car axles and suspension systems and so on, rather than pedestrian shoes that wear out because of the poor quality of the sidewalks that they have to be walking on and so on.
Definitely. I definitely did hear a traffic report on my way coming to work today. Kimisha, you wanted to jump in there?
Okay, I just want to point out something. I know Cyprine, she mentioned that we have a window period in terms of recording fatality crash here in Jamaica, which is like up to 30 days. So, you know, realize sometimes person met into crashes. So they will have up to 30 days. If they die within the 30 days, then that will be recorded under fatal crashes. So if it extends beyond that 30 days, you know, they may die from something else, but not necessarily road fatal crash. We have three categories in terms of how we record our non-fatal crashes here in Jamaica. We yes, we have the fatal, we have serious, we have minor injuries, as well as damage to property. So those three categories are taken into consideration when we are recording non-fatal crashes here in Jamaica. And as it relates to hotspot, we do have hotspot data when we're reporting for fatal data that's coming from our public safety and traffic enforcement branch. They do record hotspot areas in the fatal crash report.
That's really important. And I think to Cyprine's story, like being able to capture these numbers is extremely essential, right? So us being able to say, I think he said 30% of the fatalities are actually people who are pedestrian, right? That's a massive number, right? And being able to put numbers to this story is a big part of advocating for investment, right? So I kind of wanted to transition into that topic. So Cyprine mentioned towards the end of our presentation, some of the barriers to investing and supporting pedestrians and cyclists. So actually putting money into the actual infrastructure that will make them safer. I'm curious, lead off with you, Val, first. What are the obstacles? Why is it that, you know, road expansions get so much attention and get so much funding, but as for, you know, a ramp on a sidewalk, it's seemed as, you know, it's too much to ask for, let alone a cycle lane. Why is it that it's so difficult to advocate for this thing, even though we know it's probably going to be cheaper to build a sidewalk and a cycle lane than to build an overpass?
Yes, I wouldn't say that is, yeah, it's not the difficulty of advocating, it's the who is advocating. So, you know, the people whose voices, who are articulate, who can write, who can have access to the media and to the ears of politicians and so on, those are people who drive, and they're not thinking about the design options and the obstacles that confront cyclists and pedestrians. So part of it, I think, is just that, is just the who. The other thing, of course, is, you know, again, you know, a lot. So it's not just, I mean, a lot of the pedestrians and cyclists are, of course, majorities as well as voters. But as voters, they're voting largely en bloc, and they're voting as clients of powerful politicians. And the way clientelism works in Jamaican and Caribbean politics is that the spoils are distributed to individuals and families. We're not seeing policy in terms of larger community impact. And so, again, advocacy is in terms of what I need and what my family needs and what the politician and the state can do for me and my limited circle of people. So part of the lack of advocacy, I think, has to do with our clientelist mode of organizing our society and our politics, and part of it has to do with the ways in which the voices of the minority are amplified by virtue of their education, their status, their access to media, and so on.
If anyone wants to jump in.
Can I chime? Yes, I want to chime in on that. Value.
Cyprine, maybe turn off your camera. Your audio is coming in on. Turn off your camera.
Is doing the advocacy. So we see problem. Let me know if you can.
Yes, still not hearing everything.
Hear me now. Is it better?
Yeah, it's better.
Oh, okay. Let me turn off the camera then. So we realized that in Kenya, most pedestrians and cyclists are essentially voiceless. Nobody was advocating for the rights of pedestrians and cyclists. So what we wanted to achieve with one of the things that we wanted to achieve with Critical Mass was to give cyclists a voice, to empower them to understand what their rights are on the road, and make them build this confidence to demand for what is rightfully theirs. And slowly we've seen some transformation on our roads, and people calling out the government for not providing necessary infrastructure. So trusting the citizens to fight for their own, empowering the citizens and trusting them to fight for what is rightfully theirs is I think one of the ways we can hopefully have the transformation on our roads. It is difficult to get politicians to change, but if they know that the citizens that they are expecting votes from are demanding for something better, they will change. They will be forced to change. So that's something that that I think it's working in Nairobi. It's not yet fully there, but it's happening.
Yeah, and I think this kind of is very similar to something that was said in the last webinar by Carlos, speaker from Colombia, talked about voting based on your identity, right? So you as a pedestrian, you're voting for the interests of you as a pedestrian or you as a cyclist, as opposed to just voting for one party or the other. What are the specific needs and requirements of you as a pedestrian or you as someone who takes bus, right? And I kind of want to ask Kamisha, similar question, but kind of rephrased, kind of around the road safety unit, right? So you guys have the data, you have the information, you know what's going on the roads. How does your organization interface with, say, a national works agency or other agencies who are actually building and designing the roads? How do you work with them to be like, I want, this needs to be safer? What are the tools you guys have to do that?
All right, so for the road safety unit, we have engaged in some of the design plan and inspection of some of the roadway through our audit and inspection, right? So what that is that it is a formal and systematic check of the roadway based on evidence seen in the design plan or on the physical roadway. It provides, so the reporting, it provides countermeasures and recommendation to avoid or mitigate the impact of risk identified on that roadway. So, for example, we may, examine the design plan of the road. We may see that there is lack of lighting on the roadway. So we'll recommend that within the report for better lighting or more lighting to be on the roadway. And also as well, we said we do a physical, test of the roadway where we walk the stretch, and all hazard will pick up on that report and will make our countermeasures and recommendation to send to NAA, and they will decide on what measures or mitigations that will be implemented based on the recommendations.
Yeah.
We know the unit. Go ahead.
No. I think you're going to say what I'm going to ask you about.
Yes. So we know the unit is very small in size, and we don't have not enough funding. So we target like about 4 to 6 roadways annually across the highland to do our audit and then submit to NAA. As it relates to other research, we have done the unit does other research such as protective device studies, helmet, seatbelt, child restraint, cell phone hazard report that may impact or influence policy and decision making. But from not only research as well, we also does public education as well, which aims to promote and foster a orderly and disciplined traffic culture. So we know for this month, our target for public education is for the parish of St. Elizabeth, so we try to target youngsters, which is our vulnerable road users as well within primary and secondary school, right? We emphasize on how for them to use the road safely. And within the road safety education in schools, we teach them the curb drill, that is for them to raise their hand when they're using the pedestrian crossing as a way of elevating themselves when they're crossing the road. Also, we have the sobriety test, you know, it's to
Mhm.
call it a drunk buster, you know, it gives them the effect of what it feels of drinking while driving, you know, and
Uh-huh.
promoting not to drink and drive. So we do
I want,
public education.
I want to follow up on something that you said, right? So
Yes.
you make recommendations to an NAA, but you said a
Yes.
recommendation, right? What if
Yes.
NAA says, no, I don't want to add more lighting, or I don't want to make the sidewalk bigger? Does it
Yes.
just kind of go ahead, or do you guys have the final?
No, they would have to have the final say to recommend based on that report. Yeah.
Okay, yeah. Well, and I appreciate that you guys are a small
Yeah.
organization and you're
Right.
doing.
And their shortfall will be on them, you know.
I mean, but it's going to be on all of us, right? That
Yes.
you have made a recommendation and they decided not to take it.
Right, right.
So that is, I guess, a broader governance issue and gap that you guys aren't given more mandate to say, no, this road can't be built without X, Y, and Z. But I want to ask one more question to the panelists before we go into audience Q&A, and we have a bunch of them. And it's kind of about Cyprine's favorite term, bankability, right? So, we are living in global South countries, all of us in the Caribbean and Africa, and lots of infrastructure investment is coming from abroad, right? It's coming from IMF, it's coming from World Bank loans or international investment, right? What is the potential or the lack of potential for investing in cycle infrastructure versus pedestrian infrastructure? I want to go over to you first, Cyprine.
What is the potential? Let me turn off my video so you can hear me clearly. In my opinion, there's a lot of potential, but the way we package walking and cycling, we've not equated it as essential or as bankable as rail or public transport or carriageways. So I think we need to redefine how we package walking and cycling. We can't say we need to also include things like how the happiness level that it brings to the community, the social connections that walking and cycling infrastructure bring to communities. So it is beyond the economic what should I say? It's beyond just the economic value. There's a lot that walking and cycling infrastructure bring to a city that needs to be included when we are justifying why we need to invest in this infrastructure versus the other infrastructure. And there's also the other risks that carriageways or other expensive modes of transport pose to the environment. So we also need to include those when we are looking at investing in infrastructure. We compare which one will have the least emissions and equate that and include that in our let me say proposals or investing plans. So we need to look beyond just the economic values.
Val?
I want to go back to where I started about this status thing, and part of what's going on, of course, is that in Jamaica and in the rest of the Caribbean, we're imitating the worst of North American cities. We're imitating Florida and Southern California, rather than looking to the cities like Portland, Oregon, or European cities for our models of,
or Nairobi,
or Nairobi, exactly. So but these things can change, and in relation to funding, for example, I am struck by the fact that my understanding at any rate is that something like the plastic bags law, the ban on the use of plastic bags that came into effect in Jamaica and has come into effect in Rwanda and a number of other countries, has been as a result of the insistence of international agencies, the IMF and the regional development banks and so on, and who fund projects, right? So I think that part of our advocacy as people interested in having our cities become healthier, more walkable, and having bicycling become more common, part of our advocacy has to also think about how to make this a part of the conditionalities of funding that governments are expected to comply with. So that's,
Yeah, I mean, so there's a bunch of questions kind of on this. So there's one in the chat from Barney Gibbs, who I think is from Barbados Trailway Project. He was saying that most road infrastructure in the Caribbean is financed by entities like the IADB and CDB. Should we be lobbying directly with them and insisting that they not support kind of road or transportation related proposals unless they support active transport, unless they have active transport components? And similarly, there's another question from Amarillo Burgess about is this sort of advocacy or petitioning, should it be happening at the city level? Should we be talking to the mayors of our cities and the kind of local government officials for this? Like, which level of advocacy do you think is appropriate or efficient and effective?
Let me comment on that. So what we've been doing in Nairobi is working with all levels of government, from the local, at the local level, we have members of parliaments, and we also have
I think turn off your camera.
We call them MCAs. So we engage them. Them do not. It's important to involve all levels of government, from the local, the lowest level politician, because 90% of the time they're the ones who interact with the citizens. So engaging them and educating them to understand why it is important for them to advocate for walking and cycling, and then move on upwards and educate the national government and challenge the national government as well. I know in Kenya, several civil society organizations have been lobbying for better transport systems. And in the recent Africa Climate Week, there were several African countries that were called to task, and they had to include sustainable mobility as one of their commitments. And now it is upon civil society organizations like Critical Mass to support the government in identifying strategies that can help them deliver the commitments that they have made to the global world. I've seen in the chat a question on how we can, let me just go back to it a little bit, on whether we should ask the funding agencies, or lobby and have the funding agencies that are financing walking and cycling. And I recall early this year, I happened to attend the International Transport Forum in Leipzig, and I sat in different sessions and listened to presidents and CEOs of different financial institutions talking about why they don't finance walking and cycling. And the reason, or the excuse, was there's not enough data to back this demand for investment. So this now challenged me to come back to Nairobi and help my county government in collecting data that would position themselves to be strategic, to make them strategically positioned to receive finance. Because when I was in Leipzig, there banks that wanted to give grants. There were institutions that wanted to give free money for walking and cycling. But what they said was, our cities have not prioritized walking and cycling in their plans, So it is almost unfair for us to even blame those international organizations. Yet we haven't made our home ready for the money. So we need to clean up our act and be prepared and have data, have facts, have numbers, understand how many, the type of road users we have, why they use the road, the way they use the road. Just be prepared with data, and these banks and other organizations that want to give grants are there. It's just that we are not ready to receive the money.
I'm not sure, Val, if you had a comment on that, or should I jump to another question?
Maybe go to the next question.
Okay. So I think this is a pretty interesting question by Trevor Townsend. Is there a special push for children to cycle to school? How do you move from and also how do you move from recreational, so that's sporting cycling, to commuting cycling? I think both of those are very interesting questions. They're two different ones. Is there like a value in focusing on children and having kind of safe cycle zones to school? And also how do we, which is kind of a question in Jamaica, right? Because you have an avid sporting community in Jamaica, but the gap between them and the people who cycle to get to work is very different. Like it doesn't seem like there's much connection across those two areas. So I'll throw those two questions out to whoever wants to take it.
Yeah, I actually wanted to ask Cyprine whether the critical mass community, in addition to the one Saturday per month, are you seeing an increase in commuter cycling, and in particular by professional Nairobians and people of the Nairobi elite, or is it confined to recreational? The other thing I wanted to find out is I'm curious to know on our webinar today whether there are people from the cycling Kingston's or other Caribbean cities cycling community, the recreational cycling community of our cities. I'm just curious.
Well, we know that there is Barney from Barbados Trailway Project, which is kind of cycling pedestrian infrastructure. And I think there may be one or two folks who I know do sports cycling in Jamaica on the chat. But yes, Cyprine.
Okay. So to answer Val's question, yes, the number of recreational cyclists have definitely increased. Now I think there's no weekend that passes without a cycling event, a bike race somewhere. But the number of commuter cyclists has also increased. And there's a lot that has to do with the advocacy. We've gotten people to be more confident to use the road, but there's a lot that has to do with the traffic jams. Our traffic jams are infamous, and people are just tired of wasting time in traffic. So people are trying to find alternative ways of navigating Nairobi. So commuter cyclists have definitely increased. And something that I forgot to share in my presentation was a program that we started. Initially started it in 2019, but we had to stop due to COVID, but brought it back in 2022. And that was the Nairobi bike train. And the Nairobi bike train, let me see how best to explain it. So we realized that there were so many cyclists who only rode bicycles when we had the monthly ride. So that meant they were cycling once a month. And that's not what we wanted. We wanted people to cycle as much as possible. So we came up with the idea of having smaller critical masses coming from different neighborhoods in Nairobi, using we now have like 6 corridors. So we mapped the whole of Nairobi and identified the different neighborhoods that use a specific corridor and put them in one group. So that they could commute together to work or to school or wherever, or even have other smaller recreational rides. And it's been working fantastically. it's really encouraging to see people, you know, inviting their neighbors to come and ride bicycles with them or to commute, you know, people changing their commuting schedule so that they can ride together in groups or leave work together so that they can be safe on the road. So the concept of the Nairobi bike train is just mainly pegged on the concept of safety in numbers. And that's, you know, the reason why most people prefer to cycle with us once a month. So having the smaller critical masses through the bike trains has been effective, and the numbers are only growing. I think the largest group we have has close to 230 cyclists, and that's just one corridor. And we have in total 8 corridors, and it's really if the city government takes it up, it would be an easy way of reducing traffic jams in Nairobi. So our hope is that, you know, it can be adopted by the city and have the city can allocate pickup points along the corridor, safe pickup points that any child can feel confident to join the ride and go to school and be picked in the evening and taken back home. So the pilot, I think I can say we've had successful pilots. Now we just need to make it mainstream.
I'm aware that we are already a bit over time, but I can see that there is lots of sort of conversation, and potential cyclists and occasional cyclists are having some networking going on in the chat, which is really good. I would encourage you all to follow Critical Mass Nairobi on Instagram and social media. I think that there is lots of documentation that they do very well that could be very kind of inspiring and potentially duplicated in our island, right? So follow them. There's Barbados Trailway, follow them. Again, I think they're on LinkedIn. I'm not sure if they're on Instagram, but I want to thank all of my panelists and thank the folks in the audience who stayed in spite of all the technical difficulties that we engaged with today. Thank you, Cyprine, Charles, and Kenesha for participating in the conversation, and for everyone who kind of engaged in conversation. Again, all of our events at Island City Lab are recorded, and they're going to be posted to the Island City Lab YouTube page eventually. And lastly, we have one more conversation in the series. So please look out for marketing for that. That's going to be in October 17. And I think that's going to be a very fruitful conversation, because it's really about how do we start to pilot some of these things, right? So how do we set up a temporary bike lane? How do we set up a weekend bike lane? How do we do some of these things right now, even before we have actual big money to invest completely, right? So I want to thank you all for joining Follow Island City Lab, and look forward to seeing you all in the next conversation.
Thank you, Cyprine, and thank you, Doreen.
I had one last phrase that I wanted to share.
Yeah.
Sorry, the rain don't end. So there's this famous line that says, "Build it and they will come." But our approach has been, we can't wait for them to build it for us to come. So now what we are doing is we are going to show up, and then they will be forced to build it.
Snap, 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 snaps. I like that. I like that. Thank you so much for that, Cyprine. Always motivation. Thank you.
Well, I hope that you will start your first Critical Mass Kingston sometime.
Well, we see some cyclists already in the chat ready to join up, you know what I mean? So let's just find the people, right? All right, guys. Bye.
Thank you.
Yeah.